it up on and it's recording now so that we can get it up on our YouTube site for you guys to see later. I do have some unfortunate news to share with you guys. As of about 5:30 this evening, another one of our staff members has tested positive for COVID-19. The staff member was at work today. We have initiated full staff testing. Everyone on the admin team has tested themselves, and the folks that were still at Arcadian Cove were tested this evening. Everyone else has remained negative, so that is really good news. We will do full house Binax testing in the morning for all residents with screening of symptoms tonight throughout the night. So if your loved ones get in touch with you and say, I'm not sure why they woke me up at 9 o'clock and 11 o'clock, you'll know why. We will be taking temperatures all throughout the night for the next few days. Unfortunately, that also means that we will be on a visitor restriction until I spoke with our regional infection control specialist, Nurse Joy. So we will be on visitor restriction until we have a full round of negative PCR testing. Of course, we will use our in-house Binax Now tests in the morning to test everybody. But unfortunately, we do have to have lab negatives before we can reopen for visitation. Some good news, fortunately, since our resident population is 100% vaccinated, they do not have to quarantine in their apartments at this time. Really happy that we can still say that all of our residents are 100% vaccinated, which is really a wonderful thing for us. So they do not have to quarantine. We have been imposing in-house masking for the last week and a half. So the residents are kind of getting used to, unfortunately, wearing those masks again. They're doing a great job, most of them. But when you do talk to your loved ones, if you could encourage them to, keep their masks on as they're going to and from the dining room, as they're going to and from activities, and anytime they're in any common areas, that would be very helpful for us. I'm going to go ahead and flip through these slides this evening. Again, thank you guys all for joining us, and this will be up on our YouTube channel later, either this evening or first thing tomorrow. Please remember that everything that we discuss on the call is public information. If you have anything confidential you would like to discuss, it needs to be done in private. We try to make ourselves available as we possibly can within reason. And so if you have anything that you would like to talk with us about that is of a confidential nature, please reach out to us via email or telephone, and we will schedule either a Zoom call or at this time would have to be an outdoor visit to speak with everybody in private. Zoom calls are pretty handy and convenient, so we're happy to do those with you guys if you have something personal and confidential about your loved ones that you guys want to discuss with us. As of this morning, I put both of these up here because as of this morning, Kentucky positivity rate is 76.7%. We are the entire state is officially all in the red. Yesterday, we did have one tiny little county. I've been watching it for a few days. Robertson County was still in the orange, but as of this morning, it was also in the red. There are a lot of recommendations, but not requirements for counties that are in the red. And of course, that is masking at all times, indoors, anytime you're indoors, and of course, getting vaccinated and being vigilant with your appropriate masking above nose, below chin, and hand sanitizing and proper hygiene. But I left this up here. I left last month's rate up here just so you could see that this time last month, we were only at 12.3%. And currently we're looking at 76.7. So that has increased exponentially, which is pretty concerning. Right now, as of the time that I prepared this slideshow, death by PowerPoint, as we like to call it, as the time I prepared this, we were currently COVID-19 testing our residents in-house after a hospital trip, ER, or overnight stay, post-rehab return, upon signs or symptoms or adjacent any known exposures. And of course, we will definitely be full testing everybody in-house tomorrow morning as soon as the admin team gets there. Our staff is still receiving PCR lab tests every other week and in-house testing as needed based on exposure or signs and symptoms. I am happy to report that everybody else that was in contact with the positive staff member today, as far as staff goes, has been tested negative. It is not recommended that we test fully vaccinated individuals until the 24-hour mark. So our regional nurse said to wait until tomorrow to test those, to test our residents, which is what we will be doing. Probably bump that up about 12 hours or so and test them in the morning when we get in, just for our own safety and sanity. So I think we got a few new people on the call tonight. I just want to go over the acronyms that you might hear me use from time to time. CDC, Centers for Disease Control, CMS, Center for Medicare Medicaid Services, CHFS, the Cabinet for Health and Family Services, DAIL, or DAIL, the Department for Aging and Independent Living, and that is our state. So if you hear us say our state regulators, we're talking about DAIL. KESLA is the Kentucky Senior Living Association. They are an association that we are part of, that we belong to, that helps us out with trainings and lobbying for new movements with the government. Very, very helpful association, and they do have a website if you're interested in checking them out. And then JSL, or Jaybird Senior Living, is the management company that governs Arcadian Cove. You'll hear us talk about Jaybird or JSL pretty frequently. We have been unfortunately having an issue with getting transportation scheduled appropriately. Transportation does need to be scheduled at minimum a 48-hour notice. This can be scheduled through a phone call with Ms. LaDonna Harp at 624-0022. To schedule your calls, please call us Monday through Friday between the hours of 9 and 4. Please do not email your transportation needs to various members of the administrative team. This can get lost or overlooked. Make sure you call Ms. LaDonna directly to schedule those emails. To schedule, as the emails, like I said, might get overlooked or forgotten or lost in translation. We do take pride in making sure that our transportation specialists and concierge wear their masks when they're transporting residents. And we do provide masks to the residents to wear on their way to and during their medical appointment. And after their medical appointment, when they get back on the bus, we do give them a new mask. Right now, transportation has not been discontinued at this point, but that could change, as we all know, at a moment's notice. But it is imperative that you call us instead of texting various members of the staff or sending us emails. We do need to speak person to person on those appointments. So if you could let us know at minimum 48 hours in advance. We have been having some individuals call in and say, oh, mom has an appointment this afternoon at 2 o'clock. Can you take her? We do our very best to get everybody where they need to go. But with the current state of the way things are going and the safety of our residents and our staff members, we have a really great core group of staff members who work really, really hard, and we want to keep them as safe as we possibly can as well. So that 48-hour notice is going to be enforced now as a minimum notice for us. Of course, if there's an emergent situation, we'll do our best to get your loved ones out to their appointments. But as far as scheduling goes for our staff members, in order to keep everybody organized and in line and at their appointments appropriately and not have any unfortunate overlaps, that 48-hour minimum notice is essential. So just give us a call Monday through Friday, between 9 and 4, and talk with Ms. LaDonna. At this point, unfortunately, we are going to have to undergo a visitor restriction until we do have a full round of negative PCR tests. Labs are pretty far backed up right now, so as quick as we can get a lab in to do our testing, we're probably looking at 5 to 7 days before we get those results. Of course, we will do in-house FINEX testing, and we will email you and let you know how those are going. But at this point, until we can get lab techs to come in and do a PCR testing with our residents, we will unfortunately have to impose that visitor restriction. So please give us a call. If you're interested in dropping something off, we will go back to sanitizing everything that comes in to the building on the front porch. You can bring those tied up in garbage bags or in Rubbermaid totes, and we will sanitize them. They need to sit for a minimum of 3 to 4 hours before they go back to your loved one's apartments. We will start doing that obviously as of tomorrow. Once things return to normal, hopefully they will soon, we will be able to supply those tests as long as we have the supplies. For resident loved ones who are not vaccinated, we will be able to supply those tests to visitors. But at this time, since we are on visitor restriction, unfortunately, we will not be testing anybody except for our staff members and our residents. I did have this slide on here. Obviously can't see it because I put this big red circle over it, but wanted to let you guys know once everything returns to normal, the mask mandate probably will not change until we go back into the yellow, which could be quite some time because of all the activity that's going on right now. The mask mandate for us is currently that residents and visitors and all staff members obviously keep their masks on at all times in the common areas. Previously, we were able to unmask when we got to a resident's apartment if both the resident and the visitor were vaccinated. At this time, vaccination status does not matter. They are, the requirement is that visitors and residents continue to keep their masks on just for safety. A lot of you guys had sent me an email when I sent the email out last week about our first staff positive, requesting the vaccination status of that individual. Unless that individual wants to share that with you, that obviously is their prerogative. I am not at liberty to give you that status, individual statuses of resident staff member vaccinations. I'm not allowed to share that, but I can tell you that 67% of our staff members have been vaccinated, and that is the only statistic and number that I can share with you at this time. And this obviously is for our residents right now and any visitors. Our indoor mask mandate has been reinstated, and in order to provide the safest, healthiest environment for our residents, it is imperative that all visitors participate in proper masking. That is above the nose and under the chin, not hanging out just under your nostrils. I see that happening a lot of times that people think they're okay, and not being pulled down so people can read your lips. See that frequently. People will be talking to each other across the room, and a resident or someone will say, huh? The person that they're talking to say, huh, I'm sorry, I can't hear you. And someone will just pull their mask down so that the person that they're talking to can read their lips. We have been, being really vigilant about that. We do have notes posted for our staff in our staff computer systems, on the computer system that our staff members use to help our residents get their tasks completed on time. There is a note in there, just a quick note every time they log into that platform that says, hey, don't forget to make sure your mask is above your nose and below your chin. Please don't pull it down when you're talking to the residents. We did go through this whole thing previously last year when all this was ramping up. So it's not anything new for some of us. For some of us it is, but we will be vigilant and continue to police the situation and make sure staff members have their masks on appropriately. When the time comes that you guys are actually permitted to come back in and visit with the residents and visit with your loved ones, please don't get mad at me if I point to your nose and say, please make sure that your mask is on appropriately. It's not because I'm trying to be a prison warden. It's just because I'm trying to keep your loved ones and our staff members safe and healthy. The Delta variant is about 2 times more contagious than the previous variants, and it causes more severe illness than the previous strains. Vaccination is recommended for prevention and to decrease the symptoms and shorten the infectious period for individuals. So if you have been considering it but haven't made your decision yet, please think about that long and hard. And if you need any extra information on the vaccine, you're just not sure, you're on the fence, I have some information that I received from my boss who geeks out on that kind of thing, on how the vaccination actually works. I would be happy to share that with anybody who's interested. I'm sure that she would be fine with me letting you guys see that information as well. And something that I'm very passionate about is the mental health fallout that we are all experiencing right now. We have had some family members, some vendors, some staff members who are just fully burn out, and rightfully so, and just come in and just be so nasty with us, with our other staff members and their co-workers. And I just want to remind everybody that we are all in this together. And I just did a little quick research in previous studies that mental health issues have risen during and after elongated battles with health crises like COVID-19. We should really be mindful, as every person we meet may be fighting a pandemic battle that we don't know about. Healthcare infrastructure in Kentucky and the USA is suffering from labor shortage, physician and specialist shortages, and unintegrated treatment systems that keep the healthcare professionals from being able to provide critical care to some patients. And what I mean by that unintegrated treatment systems is that some smaller hospitals in rural counties, not sure if you guys listen to Governor Beshear's address, one reporter had asked him about particular infusions that infusion seems to be a really popular word right now, that COVID patients really needed. And while the infusion and the medication is actually available to these hospitals, the systems and the mechanics that they need to administer them, there is a shortage of those things, and a shortage of training on how to administer those things due to staff shortages. So we're all really experiencing things that we've never experienced before, like being disconnected from our support groups, our loved ones, anxiety of overthinking, relationship strains or isolation woes, and obviously employment stress and income stress. So I just want to say again, I know I say this in every presentation, but I just want to say again that we really are all in this together. We're all experiencing things. Many of us are experiencing things that we've never seen before. It's an unprecedented time. It's a huge strain on everybody. And at Arcadian Cove, I can tell you 100% that we're all working to keep the residents and our co-workers safe. So really just asking everybody to be mindful of that. Miss LaDonna gave me a plaque one time. Miss LaDonna's awesome, by the way. Gave me a plaque one time that said, "Kindness is always fashionable." And I have kept that throughout the years and keep it hanging up where I can see it, because really kindness does always win. So just want to remind everybody that we're all experiencing this frustration and this burnout, and we are still all in this together. If there's something that we can do at Arcadian to help alleviate your strain and your stress, please let us know. We're going to do our best, obviously, to help everybody that we can. And that is all I have as far as my beautiful Death by PowerPoint presentation. If you want to schedule this, actually should have pulled this slide down. I apologize. If you want to schedule your transportation, please call LaDonna Monday through Friday, 9 to 4. And when the time comes that we are able to have visitation again, we do ask that you call Sunday through Saturday between 10 and 4 to get those scheduled. As soon as that is available, obviously, I will let you guys know. I want to go ahead and just open up the floor and see if there are any questions. Does anybody have any questions for me? Not 100% sure that I can answer them all, but I'm happy to take a stab at it. Got a nice little crowd tonight. Thank you, everybody, for joining.
Chris.
Hey, Miss Susan.
This is Sue Summers.
Yes, how are you?
I'm okay. Just a question, LaDonna, earlier this week. You need forms sent in for flu shots. Is that correct?
That is correct. And that is far enough down the pike that we think that we will not have to cancel that. That is going to be on 9/16. And I wanted to address that. I'm so glad you asked. I did also put a note in with our infection control specialist. The pharmacist seems to think that that third dose of the COVID vaccine for Pfizer is going to be available at that time, and that there should not be any reactions between the two of them. But our infection control specialist, Nurse Joy, who we love and generally puts us ahead of the curve on everything, she is going to get back to me on that before we say, yes, we're going to go ahead with that third shot. All of our residents have received, I hope I'm speaking correctly, we have had some new move-ins, but all of the residents that were with us in January and February received the Pfizer vaccination, and that third dose has been recommended for the elderly population and folks that are having autoimmune or immunocompromised. Sorry, I'm getting my terms messed up. But yes, short story long, Miss Sue, if you wanted to get your loved ones the flu shot. That form should have come to you in an email, and if you didn't get it, please let us know. Okay, perfect.
And the booster will be later, because I think there's supposed to be like at least a 14-day time period between the two.
Between the flu shot and the third dose? Okay.
Or not really.
I was thinking that there should be. I can't take the flu shot without getting sick, and as we all know, I can't take the COVID vaccination without getting sick either. Everybody else had flying colors. They did a great job. But yeah, I was thinking that there should be a waiting period, but the pharmacist says that so far all of the guidance that he has received, and that is Ashley from McKay's, and he is very knowledgeable. He's a great partner to us.
He's really good.
He really is. He's amazing. We're really lucky to have them. He has said that the recommendation is that they can get them both at the same time. I did ask Nurse Joy about that to give us her recommendation and guidance. They have not at this time opened up the third dose to long-term care as of today, but we are looking to hopefully get that opened up to us at any time. And from what I understand, the third dose is not a booster. So it's just literally a third dose of the same things that we got in January.
Okay. All right. But like I said, keep us posted on the booster situation.
Absolutely.
But I will get the form in for the flu shot.
Great.
Thank you.
I think there is some terminology confusion about booster and third dose. I did read a presentation from the CDC. I'm sorry, it was the Mayo Clinic about 3 days ago that said a booster was not recommended, but a third dose was. And so that's why I had asked Nurse Joy, because the pharmacist said, yeah, let's go ahead and do the third dose. And then the third dose booster terminology was confusing to me. So I'm not a clinical physician or a nurse. I haven't even played one on television. So I asked Nurse Joy to make sure that she let us know what the best thing to do for our residents was.
All right. Thanks for the information. I appreciate it.
Absolutely. And just keep an eye on your email as usual. When I get some new info, I'll send that right out to you guys.
Great.
Does anybody else have any other questions, suggestions, or requests? We'll take those now as well. Going once. Going twice. Okay, well, if that's it, I really appreciate you guys hopping on tonight. If the situation were to continue to escalate, we will increase the frequency of these calls so that we can all get connected, and that we can get that information out to you guys in the most appropriate and convenient way possible for you all. And if between then and now you have any questions at all, please don't hesitate to reach out to us. As soon as we finish in-house testing tomorrow, obviously, we will send out an email. And if you have any questions about visitation, just give us a call tomorrow morning. I usually get there about 8:15 after I drop my daughter off for school. You can start calling as early as 8:15, and somebody should be there to answer the phones. And if there's not anything else for tonight, again, I appreciate everybody hopping on, and we will see you guys all next month, if not sooner. Take care, everybody.